when those supports aren't adequately provided, we see issues like addictions, like mental health concerns, like suicide.
Tonight, a new study on youth suicide shows at all levels Canada is failing our kids.
What can you do for Indigenous peoples who are living off the land and whose food source is threatened?
And in Winnipeg, a town hall to get people to vote and a chance to grill federal election candidates. Good evening, welcome to APTN National News. I'm Dennis Ward.
And I'm Melissa Ridgen. A national organization representing children and youth is calling on governments to address the number of youth suicides in Canada. Death by suicide is the second leading cause of death for young people here.
And advocates say not enough is being done to combat the problem. Brittany Hobson brings us this.
The Canadian Council of Child and Youth Advocates say governments are failing children and youth when it comes to addressing suicide prevention in the country.
The fact that we're the only G7 country without a national strategy is quite telling. The fact that we don't have a National Children's Commissioner in Canada is telling. The fact that we don't even have a mechanism for complaints about children who have human rights violations is telling. And as Canadians, we ought to be able to demand more.
The group released a new study on youth suicide at its national conference this week. In it, they put forth recommendations for the federal government.
We call on the Government of Canada to develop and implement a fully resourced national suicide prevention strategy for Canada with designated funding to the provinces and territories to create their own or to support existing strategies where applicable.
The group says national data on suicides and attempted suicides is lacking. They are calling for the creation of a cross-jurisdictional data system. There is no recent data examining the rates of suicide among Indigenous youth. The recent numbers from Statistics Canada show the rate of suicides for First Nations people is 3 times higher than non-Indigenous from 2011 to 2016. For Métis, it's 2 times higher, and for Inuit, it's approximately 9 times higher. How many youth are in care when they die by suicide is also not known. But Alberta advocate Del Graff says there is a direct link between the child welfare system and mental health.
Many of the young people, if not all, of young people that are within the child welfare system have experienced some levels of trauma. And trauma is an indicator that in fact they're going to need to have additional supports. And when those supports aren't adequately provided, we see issues like addictions, like mental health concerns, like suicide.
In Manitoba, Daphne Penrose's office tracks this information. Last year, 20 youth died by suicide. 4 were in care at the time.
This is a problem with respect to mental health and wellness of children and the ability for children who are struggling to be able to reach out. There are many kids in this situation that are not involved in the child welfare system.
The CCCYA recommends governments work with Indigenous youth and leadership to develop plans that will reflect what is needed in each community. Brittany Hobson, APTN National News, Winnipeg.
Inuit in Nunatsiavut could soon see significant improvements to Newfoundland and Labrador's child protection services. In a new report, the province's child and youth advocate, Jackie Kavanagh, says Nunatsiavut fear that the province's child protective services and the system is reactive and harmful. Bold systemic change is required where young people are heard, relationships are reset, power is shared, communities are engaged, resources are enhanced, and Inuit knowledge and beliefs are validated and incorporated into new ways of keeping children safe and supported. The province says it will work with Inuit to implement the report's 3 recommendations. Nunatsiavut Health Minister Gerald Asivak is optimistic the report, coupled with new federal child welfare legislation, will lead to better outcomes for families.
Having collaboration with the provincial government, because right now it's adversarial and very one-sided. The provincial government has full control. The advocates report is more collaboration and listening and working with the Nunatsiavut government to implement these recommendations. So we'll have more say and more power and to be heard.
We want to hear what you think. Here's how you can continue the conversation. You can send your emails to news@aptn.ca. You can find us online at aptnnews.ca and on youtube.com/aptn news. You can also follow APTN News on Facebook, Twitter, and Instagram for more Indigenous news. Yesterday, we told you that the government of British Columbia announced it would honor one of the calls for justice from the National Inquiry into the Missing and Murdered Women. Effective immediately, BC has ended that practice of birth alerts. Children and Family Development Minister Katrine Conroy said that her government acknowledges the trauma of these alerts, which disproportionately affect Indigenous women and children. The controversial alerts exist across Canada, wherein child welfare agencies flag a mother as a possible risk to her newborn baby, often without grounds. The alerts are tied to a mother's health file, and when she gives birth, child welfare workers are notified. Often it leads to the apprehension of newborns from hospitals. British Columbia Representative for Children and Youth Jennifer Charlesworth expects ending these alerts will have positive effects.
There's no going back, and in terms of the way in which the birth alerts have been used. However, going forward, it's a matter of the system using the array of approaches that they have available to them, or information that they can gather from extended family in order to see what other alternatives might be available to those families. So my hope would be in those removals that have taken place, where birth alert perhaps was a significant factor, my hope would be that they relied on a lot more.
British Columbia, that travels all over the world doing performances to raise awareness about murdered and missing women and girls, is now looking for one of their own. APTN's Tina House has that story. And apologies, we're having trouble finding that story, so we'll take a quick break and then we'll turn our attention to the federal election.
But first, here's a look at Wednesday's weather forecast and a look at a story that we're working on for you in the days ahead.
Médecins du Monde, or Doctors of the World, is an international aid organization deploying urgent healthcare resources to countries like Haiti, Syria, and Iraq. But frontline workers also assist marginalized populations closer to home. Its mobile clinic patrols urban areas in Canada, like on Vancouver's downtown east side, and here in Montreal, where over the years the local homeless population has grown exponentially.
We have all the stuff to do wound care, we have the stuff to do the STI screening.
And the immediate needs are becoming more obvious.
We try to be the bridge between these people and the healthcare system.
While awaiting crisis resources from municipal and provincial leaders, how are the nurses handling their workload after the closure of a crucial downtown shelter? I'm Lindsay Richardson, and I'll have more on this coming up on APTN National News.
On the East Coast, we've got 13 and sunny in Charlottetown, 11 in Cloud and St. John's. Happy Valley Goose Bay is 15 in sunshine, La Grande River 23 and sunny. 19 for Chibougamau, Sept-Îles, and Gaspés, 10 degrees sunshine there. 25 in Sault Ste. Marie, 22 in Ottawa, 24 in Windsor. 25 and cloudy in Big Trout Lake and Thunder Bay, 24 and cloudy in Sioux Lookout. 14 and rain for Puckatawaga, God's Lake will be raining, and 23. 22 and rain in Dauphin and Brandon, 23 for Barons River, Princess Harbor, Gimli, and Winnipeg. 22 in sunshine in Swift Current, 20 in sunshine in North Battleford. L'Orange will be sunny and 18 degrees, 20 in sunshine in Meadow Lake, and 15 in sunshine up in Stony Rapids.
Welcome back. The 2015 federal election saw a record number of Indigenous people voting. As APTN News reported back then, the turnout meant there were ballot shortages on some reserves. Chief Electoral Officer Stéphane Perreault held a press conference in Ottawa today. He says Elections Canada is working more closely with Indigenous communities this time around. Perreault is hopeful First Nations receive better services in this election.
We've started working in particular with 96 communities that were where there are indicators of under-registration or service problems, to engage with them earlier in the electoral cycle. So since last spring, there have been some active engagement to make sure that that we understand their needs, that we can improve their registration, and that the voting services are designed to meet their needs, and to hire more Indigenous people to work at the polls. And I think which is one of the best ways to serve them.
The Assembly of Manitoba Chiefs held a town hall meeting in Winnipeg on Monday to introduce some of the candidates running in the upcoming federal election, in hopes it will strengthen the First Nations vote. Jolene Banning was there, and she brings us this story.
The Assembly of Manitoba Chiefs are hosting a series of town hall forums called I'm First Nation and I Vote. Federal party representatives speak on behalf of their party's platforms and why they should be the candidate to capture the Indigenous vote. Candidates in attendance included Dan Vandel for the Liberal Party, James Bedham for the Green Party, Kyle Mason for the NDP, and Syra Bird for the Progressive Conservatives. The event kicked off with a song and a prayer.
I prayed on behalf of this tobacco, and I also prayed that we would share this tobacco with the candidates. And part of our teaching is that when we hold tobacco such as we do here, is for strength and also honesty, so that our candidates can speak the truth.
Historically, Indigenous voter turnout is lower than non-Indigenous voters and make up an estimated 5% of the country's national population. The AMC is hoping to motivate voters to engage by providing these opportunities: safe spaces with the presence of the Bear Clan and rides offered by the volunteer group Aquay Safe Rides Women Helping Women. Candidates highlighted their party's platform and took part in a Q&A that followed. The audience asked hard-hitting questions around education, the Transparency Act, climate change, and would the elected government enact Jordan's Principle?
What can you do for Indigenous peoples who are living off the land and whose food source is threatened?
One audience member is alarmed by the amounts of mercury in the water and food sources and needs to know what each party can do about climate change. Bird says she sees it firsthand in her community and promises consultations with First Nations. Free and prior consent is needed in negotiations with First Nations, says Mason from the NDP. While Bedham from the Green Party believes First Nations need more than a duty to consult, what's needed is to implement the UNDRIP, and resource sharing with First Nations is the way to go. However, Kathy Doyle, an independent candidate, had another point of view for Indigenous voters to think about.
And that party line relates directly to the majority population in Canada, in Winnipeg. That majority population is primarily Western European. So all of the structures, all of the systems are made to support the status quo, which is not us.
For APTN National News, I'm Jolene Banning.
A new study released on Tuesday paints a grim picture in Manitoba of the widening gap between First Nations people's health and other Manitobans. It's a joint study by the First Nations Health and Social Secretariat of Manitoba and the Manitoba Centre for Health Policy. Joining us now is Leona Starr. She's a Director of Research for the First Nations Health and Social Secretariat. Leona, thanks for joining us. This is an update on a study that was done 15 years ago. What did you discover over that time?
So what we found is that the gap is widening for First Nations in comparison to all other Manitobans. The difference in life expectancy in both males and females is now more than 10 years. The premature mortality rate is now 3 times higher in First Nations than all other Manitobans. Primary care visits to Winnipeg has more than doubled for First Nations, so First Nations are traveling greater distances to access primary health care. There's a lack of continuity of care. Suicide attempts are now 6 times higher in First Nations than all other Manitobans. And First Nations are twice as likely to receive an opioid prescription than all other Manitobans.
As we were saying, some pretty grim statistics there, and you say it's a widening gap. What's behind that widening gap?
There's many social determinants of health factors that contribute to this widening gap. The rates were high 15 years ago, and they're now worsening, also due to lower incomes, fewer employment opportunities, lack of quality housing, education, lack of access to clean drinking water. And then underlying those are the harms of colonialism, residential schools, 60s scoop, the day schools, and the most impactful one has been the ongoing discrimination and racism that First Nations people experience within Manitoba, especially within their healthcare system.
There was some pretty interesting statistics in there in terms of, the people in need of housing and that didn't trust their drinking water and felt their housing was overcrowded, all around 50% or more for a lot of these statistics.
Yeah, and there's been numerous calls to action through various reports going back all the way to the Royal Commission on Aboriginal Peoples in 1996, the Aboriginal Justice Inquiry, and furthermore the Truth and Reconciliation Commission of Canada, and most recently the inquiry into the missing murdered Indigenous women and girls report released in 2019. And these are all various recommendations that have stemmed from this and have called on all parties involved to address the inequities and disparities that have continued to affect First Nations people within Manitoba and all across Canada.
So, Leona, 15 years later, all these recommendations, how do we reverse this trend?
Some of the recommendations that we've cited within the report is access to primary health care that is meaningful and relevant in such a way where First Nations are able to design and deliver their own primary health care systems according to their own needs and priorities, and also increasing the number of First Nations professionals providing care within these institutions and clinics and within communities, but also to be able to provide cultural safety training for all health professionals delivering care within Manitoba. And also to eliminate the racism and discrimination that exists within policies that contribute to a two-tiered health system within Manitoba. And in further saying that, to stand up and answer those calls to action that the TRC report called for.
Well, Leona, it's an important report. We thank you for your work on it and for joining us here today to talk about it.
Thank you very much.
And now to that story about a dance group from British Columbia that travels the world doing performances to raise awareness about murdered and missing women and girls who are now looking for one of their own. APTN's Tina House has the story.
Butterflies in Spirit is a dance group started by MMIWG advocate Lorelei Williams back in 2011. They not only perform to raise awareness about the issue of murdered and missing women and girls, but today that issue has hit close to home. They are hitting the streets looking for one of their own dancers. 31-year-old Miranda Johnson was reported missing Saturday, September the 14th, and everyone here is worried. She was last seen here at this bus stop by her friend Grace Lewis.
She had gotten off the bus stop right behind me, and she walked up the street that way. That's the last time I seen her. She said that she had just gotten out of the hospital and that she was going to get something to eat and then head home. But I haven't seen or heard from her since.
Miranda is also a well-known advocate for MMIWG. She's also the mother of a 6-year-old boy. Valerie Davidson Orr is also in the group, and she's helping coordinate the search for Miranda.
I know there's a convenience store there. a Subway store there. There's a few other stores we could put posters up and maybe walk in the direction that you last saw her in. We're really concerned about her. Yeah, she's one of the butterflies and amazing girl.
A group of about 10 friends and even strangers have joined together to hang up posters to get the word out that she's missing. For Lorelei, she says it's been an incredibly emotional roller coaster for her, and she's really concerned for her well-being.
It's been hard. It's been really hard. She's like a sister to me, so, you know, I do this kind of work all the time, but it's not usually somebody close to me.
She's a really outgoing person. She's an amazing girl, very friendly, bright red hair. She knows a lot of people, and she's really a smart girl. So, yeah, this is really unusual for her not to contact her butterfly sisters.
We miss you. Please reach out to us. Please.
You know any information or the whereabouts of Miranda Johnson, you are asked to call your local police. Tina House, APTN National News, Vancouver.
Time for another quick break, but stick around. There's more to come.
And first, a look at the rest of Wednesday's weather forecast. To northern Alberta, we've got 15 and cloud in Grand Prairie, 18 for Peace River and Fort McMurray. Cloud and 16 in Edmonton, 17 and with a mix of sun and cloud in Lethbridge. 17 and cloudy in Penticton, 20 and cloud in Kamloops. Dease Lake is sunshine and 13 degrees. Sandspit, 18 and sunshine. 14 and cloud for Dawson City. Beaver Creek's a mix of sun and cloud, and 17, so is Whitehorse. 14 and sunny in Norman Wells, 11 and cloud in Wauhee, 19 and sunshine in Trout Lake. Tuck is 9, and so is in Inuvik, and cloudy there. Mix of sun and cloud in 3 in Sax Harbor. Snow in Cambridge Bay, 3 degrees. 14 and cloud in Arviat, 5 in Repulse Bay. Arctic Bay is 3 and cloudy. Mix of sun and cloud in Igloolik, and 4 degrees. 4 for Clyde River and cloud there. Welcome back. Artificial intelligence is changing the way doctors treat patients. A robot is now helping surgeons carry out surgeries. A handful of physicians in the UK are testing out the new equipment. The robots let surgeons operate 4 robotic arms, which are controlled from a computer. It's not actually the robot doing the surgery, though. It's the surgeon with the experience.
So the first of 3 big nights here tonight on APTN as First Contact returns.
First Contact's coming back. We've been excited about this since we heard last year that there would be a second season. So tonight's
you'll
the night.
be watching then, obviously?
I will, absolutely. How could you not? After what happened last season, it's like with their new batch of people, how's this going to go? Can't wait.
Some people are conflicted with the show, but they're going to Thunder Bay. I want to see that episode, and they're also meeting with the family of Colton Bushy. I think that'll be a good powerful episode.
Yeah.
Well, that is your APTN National News for this Tuesday. For much more, visit our website, aptnnews.ca.
That's also where you'll find more on the BC government's big decision to end the controversial practice of birth alerts. I'm Melissa Ridgen. Thanks for tuning in.
And I'm Dennis Ward. Have a great night. We'll see you back here tomorrow.